Hi, my name is Mai Buvariatagi, and today I'm going to be going over my 3D replica of the respiratory system that I made using a few household items like cardboard, straw, and balloons. So before we get started, I'd like to bring to your attention that there's two parts to my respiratory system. The first part over here represents the parts that I drew, and I'm going to use this to explain how the respiratory system works. And over here, I'm going to show how to do a live demonstration of how our respiratory system actually works in real time. Now, so the respiratory's main job is to allow for gas exchange, and it brings in oxygen and it removes the carbon dioxide. So this oxygen is what helps to fuel things in our body, like our cells and our tissues, and it also helps to do things like regulate the pH of our blood, assist in vocal sounds like I'm doing right now by talking, and protects us from any airborne particles through the mucous membrane. So air is going to start off by entering over here, which is the nose and the mouth. So once it enters the nose and the mouth, it's going to travel down into the pharynx and the larynx, which are also known as the throat and the voice box. So after it's traveled through here, it's going to go down into the trachea. The air is going to travel down here and diverge into each of the lungs. So the thing that helps it to diverge is called the bronchi. So the bronchi further diverges into smaller tubules, which are known as the bronchioles. And once this happens, there's also these small little air sacs at the bottom, which are known as the alveoli, which is what helps the oxygen to be released into the bloodstream and for the carbon dioxide to leave. So also, I drew the diaphragm over here at the bottom, which is a very crucial part to the respiratory system because it is a muscle that contracts downwards to allow to allow the air to come into the lungs, and then relaxes to push the air out. So now that I've described this, I'm going to use this part of the lung to show you how the respiratory system works. So now that I've walked you through the system, we are now going to go over two conditions that commonly affect the respiratory system, and they are asthma and pneumonia. So starting off with asthma, this is a chronic condition where the airways narrow and swell, which make it difficult for one to breathe, and the bronchi and the bronchioles become inflamed, which can cause things like wheezing, coughing, tightness of the chest, and just overall difficulty in breathing. Next, we're going to talk about pneumonia. So pneumonia is a lung infection that causes the alveoli to fill with fluid or pus, which reduces the amount of gas exchange that would usually happen in a healthy set of lungs. And it leads to symptoms like coughing, fever, and difficulty breathing, and it can even be dangerous if left untreated. Thank you for watching my video. I hope you learned a lot about the respiratory system through my model and my explanation. Yes, have a nice day, and thanks for watching.